Hello? Hello? Can you hear me?
Hello? Yes, we can hear you now, ma'am.
Yes, we can hear you.
We can hear you, ma'am.
Okay.
We can hear you now.
I'm sorry for the technical issues I've been having. I think Dr. Bruno can share the screen while I go ahead and do the presentation.
That should be okay. That should be okay.
Please, can you repeat yourself? We didn't get to hear what you said.
I said you can go ahead and share the screen while I do the presentation.
Okay, fine. That's okay. Please, can you see the screen now? Question 2, right?
No, I'm not seeing the screen. Okay, yes, I can.
Okay, so take it from there and let me know where you want me to move.
Okay, so next, I believe all of you have been able to answer the question on the poll.
Okay.
Yes, we have done.
Okay,
Yes,
please, can we go to
Yes, ma'am.
Can we go to question 3, please?
Sorry, these questions are going directly to the chats. Hello?
Hello?
The questions, we are sending them to the chat where everybody is seeing it. So are we correct? Are we doing the right thing?
No, there is a poll, which I saw.
We have already answered it.
We are not seeing it because I'm sending it.
After answering
myself,
which I have done before the lecture.
Okay, all right.
I don't know about all that. So.
Basil, are you still sharing the screen?
Yes, I am. Please, you can continue.
Yes, we have seen and we have responded to the question.
All right, I'm not. Please, can you go to the next?
But I thought we are meant to answer the question and submit. Why sending it to the chat?
Yes, that's what the question I'm asking. Because myself, I'm sending to the chat.
The three of them came together. So after answering it, there's a place they directed you to submit.
For me,
once
which
you
I
submit
did,
it goes to them.
I submitted my own.
No, I didn't see anything. No, I didn't see any poll. I'm sending mine to the chat. I didn't see any poll.
It's okay. No. It's okay. It's okay. The questions, I believe, will be sent to your email so that you have the opportunity to answer it later on. So if you haven't answered, you've not seen the poll, please be patient. So we can move ahead.
Okay, thank you, ma'am.
All right. As a way of introduction, the first slide, Bruno, please. Okay, we'll start by introducing the terms sample management. Okay, sample management refers to an organized system that is meant for receiving, tracking, storing, processing, and retrieving samples within a laboratory in order to ensure that integrity and proper identification of samples are maintained throughout the testing process. Essentially, sample management is the complete life cycle of a sample from collection to analysis and, in fact, up to the disposal. Then what is pre-analytical phase in a laboratory testing? As we all know, we have 3 phases of laboratory testing. We have the pre-analytical phase, we have the analytical phase, and we have the post-analytical phase. But here we'll be dealing with pre-analytical phase, which encompasses all procedures and protocols that takes place before the actual analysis of sample. And by this, we mean the test selection, patient identification, specimen collection, handling, and transport. As some people can also classify pre-analytical phase as pre-analytical phase. And by this, they mean the activities that is part of pre-analytical phase, but happens outside the laboratory. But for this presentation, we'll be lumping all of them as pre-analytical phase in order not to create much confusion. Okay, so what is quality control? Quality control in a laboratory setting is systems and procedures, is a system of procedure and protocols set in place in order to produce a precise, reliable, and timely result. Next slide, please. Pre-analytical phase is actually very complex. Why is it complex? It's because it has a lot of steps and a lot of people, individuals of different backgrounds involved. It's usually laborious, and that is why it is prone to error, because the more the error increases, the more the step increases, the more error increases. Therefore, in order to ensure efficient sample management, it's important that pre-analytical phase must be managed efficiently. But the limitation in management of this pre-analytical phase efficiently is the fact that it's humans that are involved. There is always error when there is human involvement, and that is why there is a need for this quality control in order to reduce these errors. Therefore, one will say that laboratory testing without error is unrealistic, but with quality control, it can be controlled to an extent. With good laboratory practice, routine reviews of processes and procedure, as well as compliance with strategies for error prevention, one can be able to reduce substantially the pre-analytical error. Automation of sample management can actually greatly eliminate these man-made errors, and therefore it will ultimately help in improving the quality of our laboratory results. And that is where we are all going. Next slide, please. So what are the key aspects of sample management? We have sample reception. Here it involves both collection of sample, verification of sample details, again, documentation, checking sample integrity, assigning unique identifiers. We will look at this in detail later. Another aspect of sample management is sample processing. Here it involves separation of sample, aliquoting, and sometimes manipulation of samples. Then another aspect is sample storage. It involves storing sample in an acceptable temperature. And it also involves organizing samples in such a way that it can easily be retrieved. Next slide. Another aspect of sample management is sample tracking, which can be done using logs and records. And in some places where we have automation, laboratory information management system can be used to manage sample details and status updates and test results. This has also helped in documenting chain of custody, so that if there is any sample missing, one can easily track it at any point in time. It also involves sample disposal, this involves appropriate waste disposal according to the law of the country. Why is effective management next? Why is effective management of effective sample management very important? It enables proper sample handling and ensures that we have the right sample for the right test at the right time. It ensures that there is consistency in procedure, therefore eliminating variability, and this in turn will lead to minimizing errors. It helps to adhere to regulatory standards for sample handling. Also, it streamlines workflow and reduces processing time, and in other words, reduces costs. So what is pre-analytical quality control? It is the pre-analytical quality control involves procedures that are aimed at minimizing error that can occur before sample analysis in a laboratory. It covers every procedure from test request to sample preparation and storage. Errors during this stage is inevitable, but can be prevented with due diligent application of quality control, continuing education, and effective collection systems. Next. What is the impact of pre-analytical error? Pre-analytical errors that are made pre-analytical error has led to a lot of deleterious outcome. It can influence the quality of the final measured results, and this can compromise the diagnosis and treatment of patients. Next. The effects of pre-analytical errors can be subdivided into two. Into minor and major error. Minor errors are errors that are detected in the laboratory, and this usually means that there is need to recollect the sample, and it leads to inconvenience of both our customers, which are the patient and the doctor. It increases turnaround time, leads to waste of effort and waste of resources. Another aspect of pre-analytical errors are major pre-analytical errors, which are not even detected both in the primary validation and secondary validation. And this mostly occurs in where there is no quality control protocols. And these results are accepted and patients are wrongly treated, which can lead to death or worsening of disease. So what is the percentage of pre-analytical errors in the laboratory? The percentage of pre-analytical errors has always been underestimated, and that is why many focus has been on just on analytical phase, ensuring quality control through the analytical phase. But studies have showed that about 65% of errors in the laboratory emanate from pre-analytical phase. And as we said before, this is due to the fact that there are so many steps involved and different categories of people, both laboratorians and non-laboratorians, involved in this step. Therefore, this leads to a lot of variability. Next. This illustrates the activities in the pre-analytical phase that occurs outside the laboratory. As you can see, almost 20.2% of this 65% occurs outside the laboratory. So whenever we are trying to ensure quality, whenever we are upping our quality assurance, we should remember there are people that are outside the laboratory that could influence our quality assurance adversely. Next. So which persons are actually involved in this pre-analytical phase of quality control? We have the clinicians that select the test that we eventually analyze. We have the phlebotomist, or even in some places you have the nurses collecting sample, and then you have the porter or even not a non-trained personnel delivering these samples to the laboratory. Sometimes they have to actually transport themselves using a transport system to get to where this laboratory is located, especially in primary health centers where there is no laboratory. They have to get to the urban areas where this lab is located. Then we have another stage where another different group of people register, and then another different group of people now do the sample processing. So you find out that there are different categories, both laboratorians and non-laboratorians, that are involved in this process. And that is why it is prone to a lot of errors. Next slide. So what are the components, key components of this pre-analytical phase of quality control that we'll be looking at? We have identification, patient identification, patient preparation before sample collection, then test collection procedures, and specimen transport, and then specimen processing. For each of the stage, we'll look at the key errors that can emanate from this stage and how we can control them. Next slide. Okay, these are in details the pre-analytical activities that takes place under each of these phase we've already mentioned. And you see there are quite a lot of activities. All right, the last slide, okay? So the first stage is the test requisition. Next slide, please. The first stage is the test requisition. Okay, here you've just some of the of pre-analytical errors we may encounter here is that some clinicians may not be able to choose the correct test. Okay, and some may feel maybe they have a house officer nearby. After writing down the test, they may want the house officer to transcribe. In the midst of doing that, there could be transcriptional error. This is another way you can have error in test selection. Some writings are not legible. This is another issue. Some use illegible handwriting. Even when they write the right test, it may not be readable. Next slide, please. Patient preparation. Not preparing patients adequately may lead to error in our laboratory results. Due to pre-analytical variables, we know that it's important for us to prepare our patients because different analytes are affected by biological and non-biological variations. And it also depending on the principle of the analysis, you may need to prepare a patient. Example, you have fasting is required for glucose and triglycerides. Some special diet like glucose is given in oral glucose tolerance test. And then for 5-hydroxyindole acetic acid, you may tell the patient not to take anything containing serotonin before the time. And then for some analytes that are affected by diurnal variation and circadian reading, you can also, there is also one needs to prepare the patient so that the patient will know the right time to come for the sample to be collected. Okay, then some of these analytes are affected by menstrual cycle, and so on and so forth. Next slide, please. Okay, patient identification. It's important that a minimum of 2 positive identifiers should be used to identify a patient, because you can coincidentally have 2 patients that have the same name. So, and that can, with the second identifier, you can easily use it as a tiebreaker. One should ensure, sometimes there is crisis when people don't, when those in phlebotomy don't do not carefully match the specimen to the patients, especially where there is a lot of work, a lot of patients crowding, and when the person that is actually doing the work is already tired, this can actually happen. Next slide. Okay, sample collection. During sample collection, there is always a position that one should attain. As we posture affects some analytes, like albumin, total protein can be affected by standing. Okay, so it's either the patient is sitting or in supine position for the sample to be collected. It's also important to identify the right collection site. Know whether it's arterial blood you need or venous blood you need, and avoid a dripped arm if as much as possible, or on the same side where a mastectomy was done, and also a thrombosed vein. It's also important that one assemble the collection system correctly, get the right tube for the right test, and the right caliber of needle, okay? Because this can lead to a lot of problem. It can lead to clotting, okay? It can even affect the result. It can also lead to interference in analysis, and it can also lead to even the damaging of some of our machine, like clots can block the probes. Tonica application not recommended. Tonic should only be in place for just 1 hour. In some cases, tonica is not. For the cleansing of venipuncture sites, we should make sure that the alcohol that is used dries completely, because this can cause hemolysis. Correct specimen volume should be used. Okay, specimen volume should be collected to avoid a situation where you have the additive being more than the specimen volume. There should also be proper tube mixing by inverting the tube at least almost five times. One should not shake the tube, rather you invert gently, okay, to ensure that the anticoagulant mixes very well with the blood. The most common error at this sample collection is usually hemolysis. We will look at that later as we proceed. Next slide, please. Okay, it's important for us to note that the CLSI have recommended an order of draw in order to prevent cross-contamination of samples. So as we can see here, the blood culture should be taken first, followed by citrates, followed by plain bottle, followed by SST gel tube, followed by EDTA, and last, fluoride oxalate. This is in order to prevent cross-contamination of sample. So this method should always be adopted when collecting sample in order not to ensure that a reliable result is obtained. Next slide, please. How do we handle containers pulled after collection? As I said before, you inventory to 10 times. If you don't do that, there will be improper clotting or anticoagulation. You do not shake because this can lead to hemolysis. Protect the sample from light. Like samples like bilirubin can degenerate if you don't protect it from light. Make sure that the samples are chilled and ensure that are chilled or warm in cryoglobulins. Avoid excessive heat or cold because they can lead to hemolysis. And if they are not chilled, it can also lead to deterioration of analytes, depending on the analytes that is in question. It's a good laboratory practice to never expose whole blood to dry ice because this can lead to hemolysis. Next slide, please. So another phase is transportation. Transportation of samples should be done as efficiently as possible. The right container should be used to transport the sample. Example, bilirubin, a foil can be used to cover the sample. During the transport, a leak-proof plastic bags in lockable rigid containers should be used so that as to avoid agitating the sample. It's also important to transport at a correct temperature. If it's arterial blood gas or ammonia, it's important for you to use a slurry ice, while in cryoglobulins should be warm. Any delay in transport may affect the result eventually, especially arterial blood gas. It's important that 15 to 30 minutes after collection of sample for arterial blood gas, it should be analyzed. It shouldn't go beyond that. If not, the cells will utilize the gas, the oxygen, and which will reduce the oxygen and then increase carbon dioxide. And this can even affect the pH, and that will give you a wrong result. Next slide. So anywhere, next slide, okay? So the next step is sample processing. It's important to register sample as soon as it gets to the laboratory. In some places, we call it preparatory room, okay? So it's a good practice to register as soon as it's delivered to the department. This is where centrifuging and aliquoting of samples usually take place, okay? And it's important that these specimens are separated within 2 hours, because if this is delayed, it may lead to hemolysis of the sample. We should also know that other samples, we can also have other samples like swab for MCS and also tissue processing. Also, in this sample processing in microbiology, you can have inoculation of sample or inoculation and and so on and so forth. For anatomical pathology, it involves tissue processing. So there are, for each and every stage of the way, quality control should be ensured. It should be done at the right temperature, and it should be done within the stipulated time it is meant to be done. Next slide. What are the causes of hemolysis, which is a major problem in the laboratory? There are different wrong steps that can be taken that could lead to hemolysis. This is, we have prolonged tourniquet, alcohol swab, use prolonged tourniquet. As we said, tourniquet should not be used for more than 1 minute. As soon as you are done, the blood is let out, you remove the tourniquet before you continue your sample collection. Alcohol swab is used, but however, it's good to use that for disinfection before sample collection. But however, do not allow it to contaminate your sample, because it can lead to hemolysis. A small bore needle should be avoided because its caliber can lead to hemolysis. Tissue trauma will lead to thrombosis, and samples collected from such thrombosed vein can lead to hemolysis. Occlusion of needle by vein wall can also lead to that. Then when we have large bore needle and syringe, you find out that you need increased pressure in order to push the plunge. That process can lead to hemolysis of sample. Shaking the tube instead of inverting can also lead to hemolysis. Freezing red blood cell, excessive heat during transports, and prolonged contact of serum or plasma with cell. And that is why we said within 2 hours is next from sample collection, sample processing should have been completed. Next slide, please. What are the pre-analytical errors in anatomical pathology? Okay, we have misidentification of specimen block or slide. This is a very common error. Sometimes, even after the whole process, one may need to recall some of this block, and then you find out that you don't know where they are. Patient identification. This has led to so many litigation. Sample identification. It's important to know whether you are dealing, especially in organs that are two, it's important to know whether you are dealing with the left or right organ and identify it as such, because it can mislead a surgeon to remove the wrong organ. Specimen must be adequate and appropriate for tissue processing. Sample process, fixative of the right fixative should be used. Okay, incorrect sectioning and staining can also have led to a lot of errors. The use of incorrect control tissue also has led to errors in anatomical pathology. Next slide, please. Other errors can emanate from autopsies, which is inability to get patient charts and relevant information from clinicians. Okay. Inability to obtain full history, indecision on which tissue or fluid to collect. And when there is no history, especially when the person, there is nobody to give a history, you find out that there could be problems. taking decision on what not to do and what to do could be a problem. Wrong identification of body for postmortem. And that is why these bodies should be correctly identified from beginning. So that because wrong identification can give wrong result, giving the wrong result to the right person. Next slide, please. So what are the pre-analytical errors in hematology? The common ones, there are a lot of pre-analytical errors, but we are just looking at the common ones. Using the wrong sample vacutainers. Example, using EDTA for coagulation test or for indirect Coombs test. Wrong sample separation. Example, using low speed for centrifugation for samples meant for coagulation can lead to platelet-rich plasma instead of platelet-free plasma that is required for such test. Inappropriate anticoagulant to blood ratio. Example, 1:9 ratio, that is 1 of anticoagulant, 9 of blood is what we required for coagulation studies. So if this is not done the appropriate way, you get the wrong result. The next slide, please. So what are the possible pre-analytical errors common in microbiology? Most of the errors are from sample collection. We have inadequate sample volume. Some samples obtained may be useless for analysis. Incorrect labeling. Contamination, asepsis should be maintained throughout the collection process. Inappropriate container. Errors that can emanate from sample handling and transportation are delays in transport delays. Sometimes it may lead to overproliferation of organism, or it can even lead to degradation of the microorganism of interest. Inappropriate storage. This can also lead to the same thing as what I said before. Exposure of sample stream temperature or light. This can lead to sample damage. Next slide, please. Next slide. So what are the common pre-analytical errors? We have errors during preparation prior to sampling. We have most commonly missing or wrong patients or sample identification. This is so common in many laboratories. The use of wrong type or amount of anticoagulants. Inadequate removal of flush solution in a line prior to blood collection. And that is why we are advised to avoid the drip arm completely, if possible. Sample handling. Mixture of venous and arterial blood during the venopuncture. Air bubbles in the sample. This can avoid tests like arterial blood gas. Insufficient mixing with heparin. Heparin can actually interfere with some of our tests. Incorrect storage and hemolysis of blood cells are common in storage and transport. Preparation prior to transfer. Here, the most common error is clots formation, clots in the sample, which I said that can affect our probe adversely, damage the probe, okay, and can affect our results. Inadequate mixing of sample before analysis. This can lead to And if one it fails to identify it, sometimes you find out that there will be poor anticoagulation or there will be poor clotting because the anticoagulants or if it's in plain bottle, the clotting may not be done well. You find clots all over the sample. Or for anticoagulant bottles, you find that the anticoagulation will not, the plasma generated may not be good for sample analysis. Next slide, please. So what are the specimen rejection criteria? Every lab should have a specimen rejection criteria. Most times these are pasted in the phlebotomy unit so that those that are collecting sample from the wards or other places will look at it and take notes. Okay, clotted sample should be rejected. Hemolyzed sample will not be analyzed. Underfilled or overfilled sample bottles may not be accepted. Insufficient quantity, but we take exception to neonates. We reject the sample because most times it's difficult to collect their sample. What happens is that one will reject that insufficient quantity, but one needs to keep the sample. And why this is necessary is because you keep the sample and then discuss with the patient, with maybe the doctor or whoever that brought that sample. Why this is necessary is that a neonate may be resampled and you may still get that small quantity. And maybe if you just running that test can give you an idea, maybe a qualitative test can give you an idea. You may even decide to change to a qualitative test in order to be able to give you an idea how you can manage the situation, because insufficient quantity of sample is peculiar with that age group. Incorrect labeling should be rejected. Failed specimen should be rejected. Incorrect patient, incorrect specimen, contaminated samples, lost samples, too old to process, broken and leaking. Even though these are rejection criteria, but it's only when you keep some measures in place before you be able to detect this and reject them. Because if there are measures in place, some of these will escape into your lab. Okay, so these are some of the specimen rejection criteria. Next slide, please. So what are the good laboratory practices for efficient sample management? Avoid storing of whole blood. Don't store whole blood at all in the refrigerator. Blood samples should reach the laboratory within 45 minutes of collection in order to ensure that separation and centrifugation of the sample is done within 1 hour. That means at most within 2 hours of sample collection, as we said before, the sample has been completely separated and stored. Avoid glycolysis by using the right anticoagulants. Avoid the effect of lights by protecting some of the samples that are meant for bilirubin, vitamin C, porphyrins, creatine kinase, and folic acid. All samples should be protected, as we said, with the right container before transport. Reduce contact with air as much as possible. This is to reduce evaporation or sublimation okay, that can occur in the sample, especially when the sample volume is relatively small and the surface area is relatively large. You may have some of this sample evaporating faster than, and when that happens, it can lead to erroneous increase in concentration of some of these analytes. Next step, please. For certain analytes, it should not be deep frozen, especially proteins, albumin, because that can affect the structure of the protein and denature protein. Please correctly thaw if you need to thaw. Look for undissolved materials and bring into solution by careful warming, because when you don't thaw correctly, it may lead to erroneous results. Store samples after analysis in such a way as to permit retrieval or confirming of results, or if there is legal issues or for whatever reason, store in such samples in such a way that it can easily be retrieved. Next slide, please. These are the good laboratory practices. In order to ensure adequate quality control in pre-analytical phase, it's very good for every laboratory to have a laboratory quality manual or handbook. And this handbook should not only be used by the laboratory. Part of it that is necessary for the pre-analytical should also be with the people that the laboratory users that are not in the laboratory. Example, in the wards, you can keep some of this manual so that they can reference. New house officers will use it as a reference material to check which sample bottles they would use to collect samples, because some of these errors can escape and get into the lab. And other necessary things. They can read through new lab users that are not in the lab, okay, that are part of this pre-analytical phase, can read and be able to enhance their knowledge and know what to do, how to transport and all that. So it's important for every laboratory to have a quality manual and handbook where written policies for sample management can be found. And the components of that should be addressed in this is information that are needed on requisitions of forms, how to handle urgent requests, how to collect sample. You see why I said in most of our hospitals that it should be in the ward, not just in, because most of us have this, but it's in the laboratory, not in the ward, not accessible to people that are also components of the pre-analytical phase of laboratory testing. So collection, packaging, labeling, preservation, and transport. Okay, it should also inform information on safety practices and also how to track samples and storage, retention, and disposal of samples. All this information should be in a laboratory quality manual. Next slide, please. So in order to illustrate what we have learned so far, we'll be looking at this clinical case. Okay, if you look at this closely, you find out that, okay, that this is a blood sample result from a 38-year-old man in the accident and emergency. And the results was shown as follows. If you look closely, you see that potassium is very high, 10.5, but corrected calcium is found to be 0.4. Okay, and because this potassium doesn't seem to be compatible with life, it was referred to the laboratory for retesting. And when it was tested again, the results showed that potassium is 3.6, while the corrected calcium is 2.4, and both of them are within reference limits. And what could have gone wrong here is either that the person that collected the sample did not adhere to the order of draw, or the person collected sample with potassium EDTA and then later transferred it for chemistry analysis. These could be the two reasons why this could have happened. Next slide, please. Okay, so this is also another sample, another clinical case where a blood sample was taken in the morning from a patient in the primary health care center and sent to the tertiary health center in the urban area. But there was a delay because there was lack of transport. And the sample was later processed and analyzed later in the evening. And is the result and the repeat. So when they did this test, when this test was carried out, potassium was found to be 6.2, which is above the upper reference limits. But a repeat showed that potassium is normal. And what could have happened here? Remember, we said that the time for sample preparation, to complete sample preparation, should not be above 2 hours from sample collection. But here we are talking of sample that was collected in the morning and was later analyzed late in the evening. Okay, so delayed transport contributed to this. The cells separated and were leaking, and intracellular potassium leaked out into the plasma. So that is what happened here because of delay in transport. Next slide, please. So how can sample management process be improved? We have looked at how to ensure quality control in the pre-analytical phase. But how do we now improve on what we have? Remember that ISO 15189 on process improvement said that there should be continuous improvement, that every laboratory should be looking for opportunity for improvement. Having looked at all the variables in the pre-analytical phase, if one wants to improve on the sample management process, what are the measures to take in order to do that? We have this diagram, okay? We have DMARC, that's what is used, what is the acronym that is used, the acronym in short. Okay, so define, we'll be looking at each of it one after the other. Define means definition of the problem. And how do you define this problem? You can define this problem by looking at your pre-analytical phase objectively, doing some reviews of every stage to see the gaps there. In some laboratory, they do internal and external audits in order to find out gaps. Sometimes this problem can also be found by monitoring customers' complaints. Sometimes It's even the workers that are complaining, okay? Sometimes it could be errors, obvious errors, okay? A record of error, maybe from incident reports, or near errors or near misses. This is where you can be able to know the problem, define it. But it's not only defining. You have to objectively establish a measurable quality indicators or objective. So after identification of opportunities for improvements, the next thing is to establish a measurable quality indicator objectives in order to measure this problem. Is like developing a standard for measuring this problem so that you objectively look at this problem. So what are quality indicators? They are established measures used to determine how well an organization meets a needs and operational and performance expectations. Okay, so how do we do this? Let's say in your laboratory, from the audits, reviews and all that, you find out that the major problem is that you have detected in the pre-analytical phase is missing sample, as it is in many laboratories. What do? You establish a quality indicator. Example, you can determine the number of missing sample over the total number of sample you have, and then know the percentage of it. These are what we call the quality indicators. If it's number of hemolyzed sample, you check the number of incidences of hemolyzed sample, and then over the total number of sample, and then determine how many percentage of hemolyzed sample do you usually have in a quarter, in a year, or that, in order to establish that this is actually even a problem. Okay, so after doing that, you analyze, you get this percentage. You analyze the data you have gotten, you get the percentage of these different, quality indicators. Then you look at them and then find the root cause analysis of these processes. We'll look at this later on in the course of this webinar. Okay, but then when having looked at the root cause analysis, you prefer solution in order to improve. It's not just preferring solution. You apply the solution preferred, and then you establish quality control to ensure that this solution that you preferred is consistent and not variable. Okay, that is what to do when you want to improve the process of sample management in your facility. Next slide, please. As we all know, there are we have said that there is a lot of error in pre-analytical phase of sample management, of laboratory testing, and is always error prone because there are numerous people involved, and humans will always have errors as far as we are humans. Okay, so what is actually the solution? The solution to a reasonable extent could be automation. Why is automation necessary in sample management? It enhances laboratory efficiency and accuracy by streamlining processes like sample tracking, storage, and preparation. And by so doing, it reduces human errors. It saves time. It provides quick data access and audit trail whenever we want to improve on the procedures of pre-analytical phase. It ensures efficient specimen tracking. It reduces turnaround time. It improves laboratory safety and improves productivities. Next slide, please. So how can we automate the pre-analytical activities? There are different phases of pre-analytical activities that can be automated. But in most institutions where you don't have full automation, especially in our country, Nigeria, find out that most of the automation are in the hands of the hospital information management system. Okay, they may have partial automation, not full automation. Where you have full automation, your pre-analytical activities are usually automated. So how can we do that? For specimen identification, automation of specimen identification involves the use of barcoding system. Barcode is the use of varying width, spaces, and sizes of parallel lines to represent data. In the laboratory, it is used to automate sample identification. With the aid of barcode scanners, it can read the barcode and transmit the data to a computer, to our laboratory information management system. Therefore, barcode can be used. The advantage of using a barcode coding system is that it eliminates work lists for the system. Okay. So it automatically chooses the test to be done and for which sample can it be done, and all that is automated. It enables the avoidance of the need for analysis of specimen in a defined sequence. Therefore, it can just choose which one to do per time because one would have programmed all this before time. It decreases chances of identification error. Barcode has been used for specimen labeling and specimen assertion. For specimen delivery, there are some of the methods that can be used. If you look at the diagram, you see somebody putting a sample in a pneumatic tube system. Okay? See, the pneumatic system is also beside that person that is putting it. Okay? So when this sample is put into pneumatic tube system, it moves from where you are. Once they press the button, it will go to its destination from the ward to the that means it has eliminated the process of porter carrying sample to the market or going to another place before it gets to the lab. So once, going to, several other things, other places before getting to the lab, delaying sample processing. Okay, so here, the sample can move using the pneumatic system, tube system. It can move directly from the ward without the interference of anybody to the laboratory. In some places, they use mobile trucks. They have robots that carry sample and they move in their trucks, in motor trucks, okay? And so on and so forth. Then sample preparation can also be automated. In some systems, you have single function workstation where you can just have automated centrifuge that is on its own, isolated. You can have decappers, you can have recappers, aliquotas and sorters. They are all different. But there are multiple function workstations, okay, that can do all this at the same time. So you find this in places where there is full automation. Next slide, please. Next slide. So in conclusion, pre-analytical error contributes significantly to the total laboratory errors. Many of these errors are from non-laboratorians, which makes it very difficult to control. Therefore, continuous review and monitoring of this phase of sample processing would lead to detection of this error and appropriate remedial and preventive measures. On the other hand, automation of pre-analytical phase of laboratory has enabled the elimination of man-made errors significantly and to a great extent enhance the production of accurate, reliable, and timely results. While aspiring for full automation of sample management, it is beneficial to good laboratory practices to enhance the quality of our results. Thank you very much.
All right. Thank you very much, Dr. Mbata, for the presentation. We'll give some time for questions and answers. Please hang in there, so that if anyone has some questions to ask, you'll be able to respond to them. So we'll leave some minutes for your questions to come in. The floor is open. If you want to do so, kindly unmute, and then you can speak. Thank you very much. Any questions, please, from the participants? You're also free to put your questions on the chat box, and I'll read from there.
Good evening, ma.
Good evening. She can hear you.
Okay, my question is from the case, the clinical case, the second one. The second one from the example that you gave, I don't know if you can project it, sir, so that she will see what I'm asking. The sodium from the case 2, yes, here. From here, the second parameter, the sodium was above the reference limit. So I would like to know from the second, when the test was repeated or retaken. So I would like to know the likely cause of it, because you made mention of the potassium as the case study, but from what I'm seeing here, the sodium was also, for the second one, was above the reference limit.
Okay.
So that's my question, ma.
Okay, the point of emphasis here is actually on potassium.
Yes.
Okay. Okay, I guess this must be a typographical error. I'm seeing where you're talking about.
All right, ma'am.
Hello, good evening.
Good evening.
Okay. I had wanted to talk about this result before the last person that asked question asked the question. I guess that this may just be a hypothetical case.
Yeah,
okay?
It is a hypothetical case.
So it's not a real result per se.
Yeah, it's not a real result.
Yeah, if we are to look at it as a real result, the parameters there don't really tally. From what we know, pathophysiologically, what can happen when results are delayed like that. Okay, so let's just take it as a hypothetical case that was painted to show, to lay emphasis on potassium, just like you have said. I think that will now take over the question I would have asked.
Okay.
Thank you, ma'am.
It's okay. It's actually a mistake. Sodium is supposed to, it is a just used for illustration, okay, of what can be obtainable when you delay sample processing, okay? So I think this is a mistake. Sodium is supposed to be within the normal reference range. Is that okay?
So we're looking out for further questions. If you have any other questions. Okay.
Hello, good afternoon, good evening.
Good evening.
Good evening.
Yes. Thank you very much, Ma, for the presentation. It was indeed very insightful. I just wanted to be clarified on the DMARC theory. If you do not mind, I would appreciate if you could just a quick summary on how to the DMARC theory, the one you posted.
Okay, so in a bit, the DMARC theory, okay, can we get to that slide so that everybody will see it for easy?
What slide number is it now?
Yeah, you are there. You are right there. You are right there. Okay, so here you define, this will be done in details during the, I think someone will handle process improvements. Okay, so I just brought it here because there must be continuous improvement, because this, a whole essence of this webinar is for you to have a large appetite of moving from where you are to where you want to be. Okay, so it's important that one should be able to know how to improve this process. So what I said is that define means that you define the problem. Okay, define the problem you have. You know, you may have a problem and you may not know actually what the problem is. So how do you define this problem? How do you know that this is a problem the lab have? How do you get to know that? It's by management reviews, okay? Periodically, there should be reviews in the laboratory, okay? Every phase of the laboratory should be reviewed in order to know the gaps, the problems. This should be the tradition of every laboratory that wants to improve. Okay, I also said that some people get to know some of these problems by internal and external audits. You know, like accreditation exercises. These are external audits. Okay, but we can have internal audits. Some laboratories organize internal audits before accreditation, but that shouldn't be so. It should be something you should be able to be doing from time to time, set out standard, and then find how you are lagging behind, okay, using the standard of measure. Okay, I said monitoring customers' complaints. You know that when one customer is complaining, it means that the complaints are so many, okay? Is that just one complaint you have is a tip of iceberg compared to so many customers that have been complaining. Then some workers, I said workers errors, near misses, errors, okay? So these form the basis for you to define the problems in your laboratory, especially in the pre-analytical phase, because we are talking about pre-analytical phase here. And when you have done this, you would have been able to identify opportunities for improvement. Is that understood? Okay, so with that now, you now define your quality indicators objective, okay? So you determine this problem you have is not just that there is a problem. How many percentage of this problem do you have? Yeah. And then how many percentage do you want to see? Because you have to have this so that you'll be able to know where I am coming from. Let's say you saw about 30% of this problem, okay, from your data, but you want to reduce it to 5%. Then you put measures in place to reduce this. So that at the end of the day, you will still use this indicator to measure whether you have improved, whether you have worsened, or whether you remained where you are after putting in place your preventive or corrective measures. Okay, so after that, you can only do that by collecting data. Okay, so you collect data. When you collect data, you will now be able to establish the percentage of the problem that we are talking about. Okay, so you analyze this data and then you look at it, you do a root cause analysis. What could be the cause of this? You look at it, in several different ways. Different cause. Is it man? Is it resource? Where is the problem coming from? Okay, if it's this problem, what is the cause of this problem? If it's another one, what could have caused this? So you look at it stepwise, and then after looking at these gaps, you now profile measures for correction, okay, depending on what the problem is, and then preventive measures. Let this not just correcting it, okay, put measures in place to make sure that it's prevented from occurring. So then you put measures in place to ensure that whatever it is that is the measure is not put in place as you like, okay, by establishing procedures that will eliminate variability, so that whatever is being done should be done the same way all the time. Like you may decide to automate. When you automate, you find that and then you find out that whatever measure you have, say, is always there, is the same way it is, okay? So these are ways you can improve on sample management process. I hope I'm clear enough.
Yes, very well, very well.
All right, thank you very much. We have some questions in the chat room. Permit me to bring them up. First of all, someone says, can we please get the slides and the recording of the presentation? Of course you will. There is a link to a course landing page. If we don't do that now before the end of next week's presentation, you have the access to all that has been done throughout since the beginning of this program. And then someone says, I didn't really understand the barcoding system. Dr. Mbata, would you throw a little light on this? The barcoding system.
Okay, I wish we can get to that slide. There is something I want to see there. I want to show her there.
Is this
okay? Can you look at the baby that has that tag on the baby's leg? Are you seeing that? Okay, that's a barcode. That barcode has encoded in it. Even though you see them as just lines, I'm sure you must have seen barcode, but maybe you won't know what it means. You can even see it in some places, okay, even in Nigeria here. Okay, so you have lines, markings, patterns, okay, that represent data. Okay, you know, like a code. Okay, you know, a code encodes data. Okay, so that's what it is. So when you use a bar, there's what we call a barcode scanner, like a scanner, okay? And then place it on the barcode, okay? It will transmit every information encoded there, like maybe the name of the patient, the ward, okay? The patient is what is staying, the address, all those information will be transmitted into our either hospital information management system or laboratory information management system. So you don't need to now be manually identifying, checking, is this okay or is this person okay? Let me your name at every stage because it's already, so this is used when you have laboratory, an automated laboratory. It's usual in the laboratory, it helps us in specimen accession, okay? It makes receiving, logging, labeling, assigning unique identifiers to specimens as they enter a laboratory very easy. You don't need to do anything. It's just all those things are already encoded in that barcode. And even your machine, the machine itself have a barcode a barcode scanner that can scan automatically the barcode on the samples, okay, sample bottle, and that can easily, it will just tell the machine, the equipment what test is required to be done on that sample. Automatically, it will do that, generate results, and that result will now show all the informations, okay, that is encoded in that barcode. It's just like all the details of the patient, both the test requested, the ward where the patient stays, address, everything. Once the test result is completed, the result will be printed. That barcode will now generate everything for you as a result, okay, and transmit it to your laboratory information management system.
All right, thank you
I
very
hope
much.
I'm clear. I'm clear now.
All right, thank you very much. If you look at the screen, you're going to see somebody using a barcode to read the data from a sample over there, a barcode scanner to read data from a sample over there. So I think it's throw a little light to what you're saying.
Yeah,
The next question says, thank you so much for the wonderful presentation. Just want you to expatiate on the avoidance of drip hand during sample collection. So asking for you to expatiate on the avoidance of drip hand during sample collection. Could you please say something about that?
Okay, we said good laboratory practice is better to avoid, if you can, avoid the hand and use another hand. That's just what we are trying to say, because it can lead to dilution of sample. And sometimes that hand, you find out that most of the veins have been thrombosed. So it's better to use the other hand if you can.
So the point is that the hand where the drip is being set is prone to admixture of the infusion and the blood. So you might just be sampling a mixture of blood and IV fluid, and then your parameters will be skewed. However, if you use the alternative hand, you're sure that even if the drip is to have an effect, it would have gone around the entire body effectively. So you'll be doing an appropriate measurement. So at best, it's best to just avoid the drip hand where possible. All right. Any other questions, please? I'm looking at the chat room. I can't find any. Is there any other person with any other question? We're already running out of time.
Hello, good evening, ma'am.
Good evening.
Oh, please, my confusion is on the the analyzing part where you said many processes, multiple analyzing or something. I can't really, I put the question in the chat box.
No, the slide is the slide. Dr. Bruno, please, that slide you just left.
Why is automation necessary for sample management?
No, the next slide. The next slide. Yes.
Is it okay here?
I'm sure this where you're talking about sample preparation, right?
Yes, ma'am.
Okay. So what we are just talking about here is that there are some, different grades of automation. Okay. So we have automated equipment that can deal with sample preparation. Remember, sample preparation is about separation of sample, okay? So there are some that can just do that at once. Once you just put your sample, it automatically centrifuges, decaps, aliquots, recap, and sort it out for you and rack it for you. I don't know, are you getting what I'm saying? So we call that multiple, from the name multiple function. It will tell you exactly what it means. It's a workstation for sample preparation that have various functions, okay? But for single function workstation, you will have to buy automated centrifuge different, buy a decapper, automated decapper different, buy automated recapper different. But so they don't work in synergy with each other. So it means that you will still be intervening, okay? When this one finish, you take it to another one. Another one will perform its function. You take it to the next one. It will, But for multiple function workstation, you just put your sample there and walk away. It will just go through the whole phases and then get to the end, and you just come and collect your sample, separated sample, already racked for you. I hope I'm clear up to this point.
Yes, ma, thank you. But I also have another question. You were saying that human beings are without error. So does it mean that using this system reduces the error?
Okay, I think you mean human beings are always prone to error. Okay, you said human beings are without error.
Sorry.
Okay.
Thank you.
Okay, so human beings, as far as you are a human, it's natural to commit error.
You are prone to error now.
They are prone to error, even no matter how, even with our quality, even with training, even with acquiring skill, you may get tired in the process. You may be overwhelmed by work, okay, and so on and so forth. So we acquire skill so that you can do repetitive action, okay, without even thinking. But as being a human being, there are situations where you find yourself still being, prone to error because you are human. Okay, so but automation, okay, eliminates not 100%, but it has a higher tendency to eliminate variability, error. If you find out that when you pipette, okay, you will still have little errors, but when that is done by a machine, you find out that it's almost perfect. So that's to show you how the same with automation. So automation will eliminate variabilities that has to do with human inabilities, okay?
Okay,
So
so
it
we don't have
tends
all
to,
day. We would limit this to one more question, one last question before we call it a day. We're almost out of time. I can see on the chat room, someone says, please, I need clarification on full automation. And it seems like you just explained that, didn't it?
okay, so maybe we'll give her a benefit of
This is
that.
exactly what she explained now.
Full automation means, sorry, we are not at the same level of, we can accommodate everybody, please. Okay, so quickly, I would like to explain full automation as, you remember I said, I don't know whether the person was here when I started, that we have different phases of laboratory testing. Okay, we have pre-analytical phase, we have analytical phase and post-analytical phase. So by full automation, we mean that this pre-analytical phase is automated, analytical phase is also automated, and post-analytical phase is automated. When you have that in your laboratory, then you can, boast or be assured that you have full automation.
All right, thank you very much.
Did you understand that?
All right, thank you very much. We've come to the end of today's program. Next week would be having a time, let's see, our schedule for next week is on, what's the title again, please? Title. Okay, so our schedule for next week says, can you get it back? Look at it here. Strategies for qualitative and quantitative quality control. So we are going to provide details of our presenter as well as the course content as soon as possible, and would issue reminders. And for some of us that may have been complaining of not receiving the emails, you may have to check your spam box, your spam boxes. And when you get there, you need to exclude us, exclude our notifications so that you can get them as they come. So without further ado, I want to thank you all for joining us today in this presentation. We hope to see you all same time next week. Have a great day ahead. Bye, everybody.
Thank you.
Thank you. Bye.
Thank you. Well done.
Thank you.